Hi guys, what's happening? Ryan here from Underground at Home. Today we're going to give you a couple of tests that you can do basically to self-assess your mobility. So what we're going to do is we're going to work through the body in a joint by joint approach. So today we're going to start off with the hips. So guys, what we're going to do is we're going to start off with our feet hip width apart, and this one's going to test your hip mobility. So what I like to do is I like to turn my toes slightly inward, and that's just going to help to engage the hamstrings a little bit more. So from here guys, next from up is the knee bend. So you only want to, we want to have a 5 or 10% knee bend, okay? Any more and you're not really testing your true hip mobility. So from here guys, just soft knee, and now I want you to push, keep your chest tall, push your bum back and see how low you can go. Okay, so guys, if you can't get down to the ankles, there's a good chance you're lacking a good amount of ankle or hip mobility. So what you need to do is push your bum back, and your goal here would be able to just about touch your ankles, okay? So guys, give that one a go and see how you get on. Next, I'm gonna give you another quick test you can do to assess another area of your hips. This one's gonna be specifically for your hip flexors, okay? So what you wanna do is you wanna lie down on the ground, and this one's nice and simple. Basically what you wanna do is you wanna bring your knee up, and you want to make sure it stays in a straight line, okay? So all the way up in a straight line. What will happen to a lot of people at home, guys, is as you get to here, you'll start to externally rotate, indicating that there is an issue with your hip flexor. So that's another quick one you can do, okay? And now guys, this is the last one I'm going to do for today for the hips, and this is going to be the 90-90 hip assessment. So what you want to do first of all is have your feet out to the side, okay? From there, you wanna rotate your knees. Now you should be able to touch both knees off the floor on one side, and then you should be able to touch both knees off the floor on the other side. And what we're doing is on one side we're testing hip internal rotation, and one side it's going to be external rotation, okay? So guys, we're going to move on from there, so do them and that will give you a better assessment of where your hips are at the moment. Moving on from there, we're going to move on to the shoulder joint and the scapula, okay? So the first thing we're going to do is, first of all, if you are training and you notice a bit of a niggle inside the shoulder when you do any pushing movements, that's an indication that you do need to have a closer look at your shoulder mobility or stability. So the first thing we always want to address is first mobility and then stability. So what we want to do is, the easiest way to test your shoulder mobility is to basically have your 2 feet together, and then you're going to have your hands up. From here, you're going to wrap your thumbs inside your fist, and then you're going to loosen everything up, okay? Next, you're going to bring your hands, and what you're going to do is you're going to see how close you can get your hands together. You want to do this without any squeezing, funny faces, or extra force. They should be nice and relaxed, okay guys? Now what you can do if you want to be really specific, the rule of thumb is you need to be 1.5 length of your hands between each fist, okay? If you're any less than that, guys, there's a massive chance you've got poor shoulder mobility. Okay, so that's going to test whether you should be safely able to overhead press, and then we're going to move on, okay? So next we can have a look at your scapula, okay, and make sure you've got decent scapula stability, okay? One of the easiest ways to do this is a simple YW test. So what you want to do is you want to be nice and relaxed, and imagine your face is actually touching a glass window, okay? From here, you're going to have your hands up either side, okay? And then what you want to do is imagine you've got 2 tea towels on your hand, so they're being pushed slightly back. Now I've got a certain amount of tension right here, okay? And from here, guys, I want to come up and back down, and making sure I'm not feeling any lumps or bumps in the shoulders, and it's moving nice and smooth. If you're noticing it doesn't feel too right and you're feeling pain, there's a good chance, guys, you need to move on to the shoulder section of the videos and start to address some of these issues. So that's going to be your second test for the shoulders today, guys. And then we're going to move on to, we've got 2 more quick assessments we can do. The next one, and it's really important, is your spine. And a good one is this one here, okay? So this is going to be the T-spine. And just remember, guys, you are only as old as your spine. It's really important to have good spinal health. So what we're going to do is, we're going to get into a quadruped position. Wrist under shoulders, knees under hips, and you're going to tuck your toes under to keep your glutes engaged. From here, index fingers pointing forward, and then you're going to twist your elbow pits forward to create a more stable shoulder. From here, you're going to come through and you're going to open. Now guys, what I like to see in a client is, I like to see a straight line from each hand. And if I haven't got a straight line, it's a massive indication that there is an issue with your shoulder mobility. Okay, so onto the other side, in, and I want to aim for that straight line. If you're noticing, guys, you're not getting all the way around, move on to the spinal mobility section and you will be able to address that, okay? So next we're going to have a look at flexion and extension of the spine. So again, we're going to go back into here. What we're going to do is, we're going to tuck, imagine your pelvis is like a disc. We're going to turn the pelvis this way, and that's going to force us into flexion, okay? And then from here, guys, we're going to go back down, and this is going to bring us into extension, guys. And if you're struggling to get into any of these positions, and a good way you could quickly assess is maybe just to shoot a quick video of yourself, and if you can't exaggerate the curve down and the curve up, it means you're lacking spinal mobility in flexion and extension, which is two of the functions of the spine, okay? So that's the next thing you want to address there with the spine, okay? So nice simple ones there, guys, and if you have issues, you know what to do, you can move on to the spine section. And then last, guys, and very, very importantly, is going to be the core. So we're going to do 2 quick tests we can do. So the first one here, we're going to lie down, okay? Now, this is going to be slightly different for men and women. For women, what you want to do is you want to come down and you want to bring your palms to your chin, okay, and roughly in the middle of the shoulder, okay. Now from here you want to tuck your toes under, and then what we want to do is we want to push up off the ground, and we want to be able to push up with the lower back coming up at the same time, okay guys? And if you're noticing this is happening, this is a good indication that you've got a weak core and you need to work on that. And for men it's slightly harder, okay? It's up just at the hairline, and it's going to be the same thing then. Tuck your toes, and the bum should be the first thing to leave. And if not, guys, you need to work on your core. Okay, and the last test, guys, is going to be the rotary stability test. And this is going to test your rotational stability. So in you go, okay? You're going to extend your right arm and your left leg, okay? Touch your knee off your elbow. And if you can't touch your knee off your elbow, that's a spinal mobility issue, okay? And you'll move on to the spine, okay? Even though we're testing core now, back out again, and you should be able to do that without falling over, guys. So test left, test right, and if you fail either of them 2 core tests, you move on to the core section. And if you can't touch your knee off your elbow, that will be back into the flexion and extension section, so that will fall into the T-spine area of the mobility section. Okay guys, so if you had any issues with any of the tests today, jump down and jump into the videos. And what I would recommend is doing the videos, I would say 3 times a week, and you will notice a massive difference in your overall mobility and in the comfort of when you are doing our online workouts as well. Thank you very much.